My paper is on the history of cholera. From the beginning of mankind, diseases were noted long before man knew what caused them. Mankind also knew about the importance of good food and water sources for the health of the community. Now we know that cholera is an acute waterborne disease that is caused by eating food or drinking water contaminated with a bacteria. The cholera bacteria mainly lives in warm and salty waters in coastal regions. Most cases come from eating undercooked or raw shellfish. The symptoms can include diarrhea, vomiting, stomach cramps, and severe dehydration. They can take anywhere from 12 hours to 5 days after ingesting contaminated food or water, and can kill a person within hours of the first symptoms if they're not treated. Prior to the 18th century, diseases such as cholera were often considered a sign of poor moral and spiritual character, and prayer was used as a cure. Poor people lived in urban slums, suffered more instances of cholera than rich people did. To contain the spread of the disease, public effort was made to quarantine travelers and isolate ill people. It was still not known the cause of cholera, but it's thought to have come from bad air. The first noted pandemic occurred in India in 1817, and from there it began spreading to the Western world in the 1800s. Came to the United States in the mid-1800s. The exact cause of cholera was not known until 1850s, when a London doctor by the name of John Smith determined that the outbreak was due to a single drinking water source. He noted that the water contaminated with sewage was spreading the illness from one resident to another. He theorized that the disease might be tiny parasites or germs that was able to reproduce in the environment. In 1854, Filippo Passini was the first person to identify the Vibrian bacteria that caused cholera by examining the corpses of patients who died in the public hospital and those of the washerwomen in charge of cleaning the hospital linens. Passini described the disease as a massive loss of fluids and electrolytes, and recommended that people who had symptoms of the illness to use IV sodium chloride diluted in water to help control the symptoms. In 1892, the first anti-cholera vaccine was developed. Cholera pandemics have continued, but on a much smaller scale over all of the years. The development of oral cholera vaccines have proven to be a significant advancement in treating cholera since the 1950s. The Global Task Force on Cholera Control revitalized its program in 2014 to control cholera globally, and is challenged with promoting and implementing strategies for cholera prevention, as well as increasing the awareness of the importance of global public health regarding cholera. Some of the challenges faced for health educators in eliminating cholera include education about what causes the disease and teaching people how to maintain good hygiene, proper sanitation, and maintaining a good water source. It's also important that the oral cholera vaccines be administered in areas that have potential for cholera outbreak. It is hoped that by the year 2030 that cholera will be reduced by 90% as through the Global Task Force of Cholera Control.